Are you over 50 and noticing your eyesight isn't as sharp as it used to be? Blurry text, trouble reading menus, or struggling to drive at night? Most people think poor vision is just part of aging, but the truth is you can take control. With the right nutrition, habits, and proven eye health hacks, it's possible to restore clarity and protect your vision for years to come. Understanding age-related vision decline after 50 eyesight changes are among the most common health challenges people face after turning 50, and they can have a significant impact on daily life. Many adults begin to experience presbyopia, the natural stiffening of the eye lens that makes reading or close-up work difficult. Others develop age-related conditions such as cataracts, macular degeneration, or glaucoma. These issues are not sudden but develop gradually over time, making it essential to pay attention to early warning signs like blurry vision, difficulty reading in dim light, eye strain, or increased sensitivity to glare. The decline is usually the result of multiple factors: natural aging of the eye tissues, reduced circulation to the retina, oxidative stress caused by free radicals, and unhealthy lifestyle habits accumulated over decades. For many people, poor eyesight is mistakenly accepted as an unavoidable part of aging. But research shows that vision health can be preserved and even improved with the right habits. Restoring eyesight does not mean reversing aging entirely, but supporting the eyes through nutrition, exercise, preventive care, and protective measures that enhance their resilience. Understanding these mechanisms is the first step toward regaining control. By learning how age affects the eyes and what can be done to counteract these effects, people over 50 can delay vision decline and in some cases even restore sharper eyesight. The good news is that the eyes are highly responsive to healthy changes in diet, lifestyle, and daily habits. With consistent care, it is possible to maintain strong vision well into the senior years. Nutrition and supplements that strengthen eyesight. One of the most powerful ways to restore and protect eyesight after 50 is through targeted nutrition. The eyes require specific vitamins, minerals, and antioxidants to function at their best, and deficiencies often accelerate vision decline. Nutrients like vitamin A, C, and E play a direct role in maintaining the retina and protecting against oxidative stress, while zinc supports the transport of vitamin A to the retina, improving night vision. Omega-3 fatty acids, found in fish like salmon and sardines, help maintain the moisture balance in the eyes, preventing dryness and irritation. Lutein and zeaxanthin, carotenoids concentrated in leafy greens such as kale, spinach, and collard greens, act like internal sunglasses by filtering harmful blue light and protecting the macula. Research also highlights the benefits of bilberry extract, which improves circulation in tiny eye capillaries, and ginkgo biloba, which boosts oxygen delivery to retinal cells. Supplements like ARDS2, age-related eye disease study formula, have been shown to slow down the progression of macular degeneration, a leading cause of blindness in older adults. For people with limited access to fresh produce, high-quality eye health supplements can provide concentrated doses of these nutrients. However, diet should remain the foundation. Colorful fruits, vegetables, nuts, seeds, and oily fish all contribute to healthy eyes. In addition, hydration is critical, as the eyes rely on fluid balance to keep tissues nourished and free of strain. By fueling the body with the right nutrients and ensuring consistent hydration, people over 50 can give their eyes the support they need to repair damage, reduce inflammation, and maintain clarity of vision. Nutrition is not an overnight fix, but long-term adherence can bring remarkable improvements. Eye exercises and lifestyle habits for sharper vision-restoring eyesight after 50 is not just about what you eat. It is also about how you use your eyes daily. Modern lifestyles, dominated by screens, artificial lighting, and long hours of close-up work, place enormous strain on aging eyes. Eye exercises can counteract this stress and strengthen visual muscles. Techniques like the 20-20-20 rule, where you look at something 20 feet away for 20 seconds every 20 minutes, reduce digital eye strain and refresh the focusing ability of the eyes. Palming, an ancient relaxation method where you gently cover your eyes with your palms in a dark environment, helps relax the optic nerve. Other exercises like shifting focus from near to far objects or slow eye rotations improve flexibility and coordination. Beyond exercises, lifestyle habits play a critical role in vision restoration. Adequate sleep allows the eyes to repair and rejuvenate, while regular physical activity improves blood circulation, ensuring that oxygen and nutrients reach the eye tissues effectively. Managing stress is equally important, as chronic stress constricts blood vessels and reduces oxygen supply to the eyes. Smoking should be eliminated completely, as it is one of the leading preventable causes of cataracts and macular degeneration. Alcohol should also be limited, since excessive consumption accelerates oxidative stress. Even small daily changes like blinking more frequently, adjusting screen brightness, and ensuring proper lighting when reading can collectively protect eyesight. Over time, these exercises and habits not only slow down decline, but also sharpen visual acuity, allowing individuals over 50 to maintain independence, confidence, and quality of life. Medical treatments and preventive care for eye health, while natural remedies and lifestyle changes provide a strong foundation for restoring eyesight. Medical treatments and professional preventive care are equally important. Regular eye exams become increasingly critical after 50 because many vision-threatening conditions, such as glaucoma or diabetic retinopathy, can progress silently without noticeable symptoms until it's too late. Eye doctors can detect early changes and provide timely treatment, significantly improving outcomes. Treatments like corrective lenses or progressive glasses can immediately enhance clarity for daily tasks, while specialized contact lenses may help those with specific corneal issues. Surgical options, such as cataract surgery, are highly effective and safe, often restoring near-perfect vision in patients who had severely clouded eyesight. Laser procedures like LASIK or PRK may also be suitable for some older adults, depending on corneal thickness and overall eye health. Newer innovations, such as injectable medications and retinal implants, are providing hope for conditions like macular degeneration. In addition, routine preventive steps like controlling blood pressure, blood sugar, and cholesterol play a direct role in protecting eyesight, as systemic conditions often impact the delicate vessels of the eyes. Protective eyewear, including sunglasses that block UVA and UVB rays, can